You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is a board-certified periodontist. He's from Long Island, and he seems to be the go-to guy if you're considering dental implants. Dr. Scharf, welcome to the program.
Thanks for having me,
Welcome
Randy.
back, I should say.
Thanks. Great to be back.
Now, as a periodontist, for those that don't know, tell us the different things you treat and your typical patient.
Well, as a periodontist, the focus of my practice is treating gum disease, and we treat gum disease with a laser, and also placing dental implants, restoring people's smiles with dental implants. So we get people who've lost teeth from gum disease because they've cracked a tooth, they had an accident, and they're either missing a tooth or they're wearing something that's unsatisfactory. And one of the most satisfying things we do is give them back their smile by putting dental implants in.
Okay, good. Now, we've had you on the show talking about dental implants in the past. Big response from that, by the way. A lot of people coming in.
Yeah, it was very exciting. You know, what I found most gratifying was people who thought there was no hope that found out that there was a hope for their situation.
Because there's a lot of people, now this is, and you say that they self-diagnose. That means they're in their 70s, which is very young, and they say, I'm too old, or I have osteoporosis. And these people are candidates, you're saying.
A lot of people, self-diagnose is a great word. They either think they're too old, or they have medical problems, or they think, well, if I lost my teeth because I had no bone, how can I possibly have dental implants? So rather than take that step to find out whether or not they're a candidate, they just assume that it's not going to be for them. And then they heard the show, where they did some reading, came in, found that they can get dental implants. So it's been exciting.
Now, board-certified periodontist, what does that mean?
Well, to become a dentist, you need 4 years of dental school. After that, to specialize in periodontics is another 2 or 3 years. After you complete a perio program, you can call yourself a periodontist, but board certification is the final step. And only about a third of periodontists ever become board certified.
Now, you teach dentists. You're associate clinical professor at New York University College of Dentistry. You teach other dentists that want to be specialists. Tell me about that.
Exactly. I train dentists from the U.S. and from all over the world who come to New York University to specialize in either periodontics or dental implants. And the teaching involves both lecture, treatment planning, helping them look at a case, decide what treatment options there are, deciding how to treat the case, and then sitting chairside with them to physically teach them the clinical skills they need to be successful specialists.
What's changed? Why is it better now, easier now, to get dental implants than it was, say, 10 years ago?
That's a great question. You know, a lot has changed. First, treatment time is much faster than it used to be. The old protocol used to be take a tooth out, wait 6 months for the bone to heal, put the implant in, wait another 6 months. The implant would be submerged under the gum. Then we would uncover it and make the crown. So
why the wait, by the way?
Well, you'd need that wait for the implant to fuse with the bone. Nowadays, under the right circumstances, we can do what's called immediate placement and immediate load. We can take a tooth out, put an implant in the same day, and in the right conditions, put a temporary crown on the implant the same day.
So that happens, by the way. We're talking about ideally. I mean, you have patients that get this tooth in a day. Is that right? I mean, is that real?
It's really very common. Again, it comes down, not every patient is a candidate for that, and we know during the workup phase whether or not they are. But more commonly than not, we can take the tooth out, put the implant in that day, and at least put a temporary crown on the implant so someone can leave the office, look good, feel good, go about their business, and then once the implant is fused with the bone, the dentist makes the final crown.
Okay, now we were talking about changes. Okay, so now you can do it much quicker now because of the implant, the bone's holding on to that implant faster, I guess.
Right. And one of the other biggest changes is diagnosing the patient and knowing before you do the surgery whether or not they're a good candidate. And that's where computers and technology really help us. First, years ago, we used to just take a regular dental x-ray, which was a two-dimensional x-ray, and we wouldn't really know whether or not the bone was wide enough or strong enough to accommodate the implant until we opened the gum up and started to place the implant. Nowadays, we use two things which have helped a lot. One is called an iCat scanner. So an iCat scanner is a machine in the office which, in effect...
Do you have it in your office?
We've had one in the office a few years now that takes a dentist scanner, in fact, a CAT scan of the patient's jaw. So someone comes in for an appointment. They used to come in, we'd examine them, we used to have to send them to a radiologist's office. So they'd have to come back, go back and forth. Now we can take it right in the office, and it shows us right on a computer screen whether or not they have enough bone and how dense the bone is. And then we use a program called Simplant, and Simplant lets us do the surgery in a virtual way. So we can virtually place implants in their bone to determine the length, to determine the size, to determine the quality of the bone around the implants. So by the time we get in to do the implant surgery, there's no more guesswork. And then the third part
in the old days, was it guesswork because of imaging?
Sometimes it was guesswork because you didn't know the amount of bone that was there until you actually open the patient up. And it amazes me, there's still people that don't get dentist scans for patients, and they open up the patient and find out that there's not enough bone. And then the extension of this technology is that many cases we don't even have to open the gum up anymore. We can use that computer technology to actually guide the implant placement so that whatever we do on the computer, on that computer software simulation, can be replicated in the mouth without ever having to open the gum or to stitch the gum closed. And that's tremendous.
What are the different categories of dental implant patients that you see?
We see a wide range of patients. First, there are the denture sufferer. These are people who have dentures that are just miserable in their dentures. They're loose, they clack around, they can't eat, they feel insecure, they're afraid of talking at friends because they're afraid their dentures are going to fly out. And these people become recluses almost. They don't want to socialize, they don't want to go out to eat.
Did they tell you this?
Yeah, many times they tell us, or sometimes they tell us afterwards how the dentures have helped them. Sometimes they say, I didn't realize how much these dentures were affecting me until I didn't have them anymore. How I used to really shun certain foods, or I wouldn't want to go out with people, or I'd be embarrassed talking to my coworkers, or I'd always put my hand over my mouth. That's a big one. People say, I didn't realize how I'd put my hand over my mouth because they were embarrassed about their dentures moving. So we can help those people either by putting in a couple of implants so the dentures snap in securely, or many of them choose to have either 4 or 6 implants placed and get rid of the denture altogether to have something that's completely fixed in place.
Permanent in their mouth.
Permanent, doesn't come in and out.
I mean, when I hear this term, no more dentures, with as little as 1 or 2 appointments, get a fixed set of teeth in their mouth, maybe 4 or 6 implants. That's true. That's possible.
What's amazing is that you can replace a whole jaw of teeth in the lower with 4 implants, in the upper with 6 implants. So a lot of people think, well, you need 1 implant for every tooth to be replaced, and that's not true.
Just not so.
They're so strong that 4 or 6 implants strategically placed can support a whole jaw of teeth.
So it really raises their self-esteem, though.
I'll tell you a great story. I have a couple that I treated, an elderly couple, did some implants for the husband and the wife. And the wife was a beautiful woman, had dentures which were loose all over the place. They came in, I think they saw the first show, they came in, I did implants for her, top and bottom, so that she now had dentures fixed in place. And the husband said, she's like she was 40 years ago again. He said, and these were his words, her personality has just blossomed again. They go out to eat, they go dancing.
I mean, just because of her teeth?
It's easy.
I mean, I am skeptical when I hear these stories.
It's easy for you to say that because you're not the sufferer. You're not the one who's embarrassed that you're going to talk on TV and your dentures are going to fall out on the table here. You're not the one who's maybe embarrassed that the dentures are clacking when they go out to eat or gets a seed caught underneath. And it's gradual. It's not that they shut down immediately, but it takes a little bit of their self-esteem day by day, week by week, and it's a slow decline. And the beauty of putting the implants in is that it happens so quickly and the restoration is so fast that you just see people blossom. It's very gratifying.
Since last time I interviewed you, what was that, a couple of years ago?
Yeah.
Okay, so you've met a lot more patients. I mean, do these stories, is this one of those things where they say, I should have done this years ago?
Yeah, and many times when they say that, I say, well, why did you keep away? And they say, well, I either thought it was, I couldn't afford it, it wouldn't fit in my budget, or I thought it was very time-consuming or very painful. So a lot of things that we addressed in the other show I think were nice because people realized that it doesn't have to break the bank to have their teeth replaced, that it's not a long, drawn-out process, that it can be a comfortable process, and it's attainable. The average person who gets dental implants is the average person. They're not, they're the average person who wants a solution to what's troubling them.
My 74-year-old mother says, I'm too old to get dental implants. She thinks I'm crazy.
That's interesting. You're never too old to get dental implants. My grandmother is 95 or 96 now. When she was 91, she always had all her teeth. When she was 91, she started to lose teeth. They started to decay. And she needed 7 teeth taken out. So here's a woman who's 91, has had all her teeth her whole life, and suddenly she had to lose teeth. And I took her teeth out for her, and I put dental implants in the very same day.
How old?
She was 91 at the time, and
we
waited a few months. After a few months, she had the teeth put on top of the implants, and she said to me, I don't understand this. I know you took my teeth out, and now I have my teeth back again. How'd you do that? And so I explained the whole dental implant process. And Randy, she's in a nursing home now, and I visit her a lot. It's right near my house. I love to visit my grandmother. And when I sit at the table with her in the dining room, she sits with the same women. Some of the women have no teeth at all. Some of the women have dentures that they put on the tray. They eat mush, they eat whatever they want. They eat mush. I look at my grandmother's tray. She has an apple. She has a hard roll. And as you get older, your vision may go, your mobility may go, But what's the one joy you have from when you're an infant, hopefully to your last breath, is being able to eat and enjoy your food.
Good point. Excellent.
And it makes me feel great to be able to see my grandmother be able to eat whatever she wants and really not have that hanging over her.
Now, what are the other fears, by the way? You know, if we brought in a bunch of denture wearers, what are their fears about dental implants, or misconceptions, I should say?
A big misconception or a big fear as well, that maybe they won't work, that maybe my body will reject the implants. And the reality is that implants fuse with the bone 98% of the time. And the 2% of the time that an implant doesn't fuse, we just replace it. There's no additional fee to the patient to replace it, but it happens 2% of the time. And
2% of the time nationwide?
Yeah.
Okay.
And most of the time, when we put that second implant in, that second implant is going to fuse. The second fear I think that people have, which is a big one, is that it will be unaffordable. And that's probably second, I think, to rejection.
So 4 dental implants, that's what this all on 4 is, to secure a lower denture.
Yeah, and we do it all the time.
Is it called a denture? What do you call it, by the way?
We'll call it
fixed?
an implant bridge or an implant prosthesis.
How soon can they eat, the denture wearer? How soon can they eat after the procedure, in an ideal situation?
They can eat right away. You know, until there's some healing of the soft tissue, it's good that they eat soft food for maybe a week or 10 days. But after that, they can just eat whatever they want.